So there are two things that I think about, and I really want everyone to know that access to healthcare is not a one-size-fits-all. Again, there's disparities associated with access to healthcare. So while some patients may have insurance and they may be able to go to a private doctor or an endocrinologist, other patients struggle. They have challenges because they don't have insurance. They don't have the same health access to healthcare that the others may have. And so what that does is it puts into place a situation where one person's healthcare outcome is probably going to be different. More than likely, it's going to be better if they have access to healthcare or access to insurance, whereas another patient's healthcare outcome may not be so great because they don't have the same access to healthcare or access to insurance. So imagine, and I've seen this before, I experienced it a couple of times, where a patient will walk into a clinic and only to be told, you've been here quite a few times and you haven't paid everything you needed to pay, so now it's time for you to visit our financial department. And the financial department is maybe 2 or 3 miles away. So now you've got a patient who has to drive 2 or 3 miles away. And then when we think about disparities, does that patient even have transportation to drive those 2 or 3 miles? And then that patient has to drive back once that financial problem is settled and hope that their appointment is still available. And so these are things that patients shouldn't really have to worry about when they're trying to manage diabetes. And again, these types of situations can discourage patients from wanting to really focus on trying to get their diabetes or manage their diabetes as well as they could potentially if they had insurance. So I think that's one thing. The other thing is access to medication. So when you think about life-saving medications like insulin, a patient that has insurance will be able to walk into the pharmacy, their insulin is covered, they walk out and everything is great in most cases. But a patient that does not have insurance, if someone isn't really working with them, a social worker or someone a family member who can really help them, then they just don't get their medication and they just don't have a way to be able to lower their blood glucose. It presents a problem. Again, the disparity between a patient who can afford to walk inside of a pharmacy and get their medication and complete their regimen versus a patient who just can't do it because they're not covered or the medication is too expensive. These are disparities that would not allow that patient to have a positive healthcare outcome. And if I could really think back to patients that have access to things like CGMs, continuous glucose monitors, insulin pumps, these patients have a disproportionately better healthcare outcome than those who don't have access to these life-saving pieces of technology. And when I really think through the entire scope of everything, these are the patients that really need it, because these are patients who are working every day. They can't afford to take time off, because if they take time off, they're probably not going to get paid for that day. They're not going, so, these are things that patients really need, because if they're working, it would be great if they didn't have to take time off, walk to the bathroom and test their blood sugar with a finger prick. They could just scan or take a look at their CGM, their continuous glucose monitor, and be able to determine exactly what their blood sugar is. So again, there's just enormous disparities, which can attribute to positive healthcare outcomes versus outcomes that are not so positive for some patients. And if I could sum it up, I wish the world could know that